Hello and welcome to Physio Poetry with Alhaz sir. I know, it's been a while since I have posted some educational video, but trust me, I have been a bit occupied with some new work. I got some time right now, so I'm making this up. So as you can see, I am starting a new series with a different topic from physiotherapy aspect. From my interest and most of the from your interest. So in today's video, we will be learning about fracture and fractures classification. So yeah, it's something apart from a physiotherapy, but yes, we will be starting this series, and I hope I continue it till the end. And so yeah, without further ado, let's begin. So we often hear that someone got a fracture, someone fall, someone got injured, someone was occupied with some fight and he sustained a fracture, someone was playing something and he or she got a fracture. So हम ये terms बहुत बार हमारे रोजमर्रा की जिंदगी में सुनते रहते हैं. But what is fracture? By definition, if we go, so it is a break in a continuity of a bone. तो बोन होता है हमारा, तो बोन की अगर कंटिन्यूटी में कहीं पे थोड़ा सा भी अगर ब्रेक आ जाता है, कहीं से भी वो टूट जाता है थोड़ा सा भी, इवन इफ इट इज अ हेयर लाइन ऑल्सो, we will call it a fracture. As we all know, our bone made up of there is a diaphysis, the shaft. If you talk about the long bone, the diaphysis is there. We have metaphysis and we have epiphysis, the condyles or the end part of a bone. So this whole made a bone. We all know that bone have a central hollow structure जहाँ पे bone marrow रहता है. So here I have drawn a cross section of a bone. Please consider this green part as a bone marrow, and I didn't had a yellow marker with me. So we will consider this as a bone marrow. We know the outer structure of a bone. It's a hollow structure. There are pores in it which made our bones a bit lighter, but they have a good strength in them. The outer layer is known as periosteum, which is the outer covering of a bone, which separate the bone from the outer viscera or the muscles. So this is the basic structure we know about bone. So when I talk about the definition of a fracture, that it is a break in a continuity of a bone. So even if the periosteum is broken, even if there is a slight break, slight discontinuity in the periosteum also, even the bone hole is intact, the periosteum is only break, we will call it a fracture. So the terms are very clear. Or if there is any break in a continuity of a bone, it is a fracture. Whether it's a complete fracture, whether the bone is in there in a 3 pieces or 4 or multiple pieces, or whether there is a slight hairline fracture, it's a fracture. And we all know, we have heard different kind of people that they are having fracture, they sustain a fracture. But in today's lecture, we will know about the whole classification, which are the ways with which we can classify the fracture and how we can differentiate the fractures. It helps us to identify in a medical field that a person has sustained with what kind of fracture and what kind of severity is there, and what kind of treatment will be needed and what kind of procedure to be followed. So it is very helpful to know the classification, which will help us in the further rehabilitation. So let's begin. So as I have said, fracture is a break in a continuity of a bone, and a fracture can be classified into multiple ways. We can classify according to the etiology, how it has been caused. We can classify into the complexity. We can classify into the fracture's relationship with the external environment. We can classify the fracture with the quantum of force which causing the fracture, which can classify according to the displacement, we can classify the fracture according to the pattern. So let's begin. First, we will know about the etiology. So what are the causes? What is the causes which is the reason why the fracture is happening? So according to that, which we can classify the fracture into 3 main categories. One, and the most common categories where almost all the fracture lies, are the traumatic fracture. Due to any trauma, a fracture is happening, we will put into this classification, this condition. We all know if someone had a motor car accident, or someone had a fall, someone got hit by something, someone was ran into a fight, someone was there playing some sports and got injury by colliding with another player. So everything, if the fracture is caused by a trauma, it's a traumatic fracture. So it can be due to fall, any RTA, road traffic accident, or due to any fight. So they are considered as a traumatic fracture. Then moving forward, pathological fracture. One of the most, second most common is a pathological fracture due to any pathology in a bone or in a body which will causing the fracture. It can be anything. It can be a malignant, it can be a something tumor, it can be a bone cyst, it can be due to age, the osteoporosis, it can be due to any condition which is a pathological condition. No direct trauma is involved, no direct what do you say, no direct injury or no direct blow is involved, but the main cause is pathology. Okay, I don't know if you are a movie nerd or not, but there was a one movie, or Hollywood movie from M. Night Shyamalan. It was naming The Glass, and a case of where I forgot the name of the actor, but yeah, he was Samuel L. Jackson is playing the villain's role, and he has this rare condition where his bones are very fragile. So, and it's a by birth condition, and due to that he sustained fracture due to a fall or due to hit by any thing very easily. He sustained fracture because the bones are very fragile. So I got that into my mind. So if it's a pathology involved and it is causing the fracture, it is your pathological fracture. The third is stress fracture. Now, stress fracture are commonly seen in bones where the bone is under certain stress for a longer period of time. So if you see a runner, or if you see an athlete who he or she is training their bones or training their muscles a bit more. So if the bones are having repeated trauma over the period of time, if the bone is sustaining a repeated injury over a period of time, so because of that a stress fracture can develop. Because of the stress, because of the continuous pressure on that bone, a person may develop a stress fracture. It can highly seen in runners, in athletes, in gymnastic person, or in someone who is doing a karate or anything. So when they are training their bones, they are hitting their bones with a object. So when we are running, what happens? We are pushing the bones quite often. So it can lead to stress on a bone, and because of that, for over a period of time, we can have a stress fracture. So these are the main three categories where we can classify them according to the etiology. Moving forward, according to the relationship with the external environment. Now, here, when we talk about the external environment, it can be either closed or it can be open. So what does it mean? Relationship with external environment. मतलब अगर मान लो कि fracture हो गया है, so if the outer skin is intact, the bone, the fracture is not in contact with the outer environment, so it's a closed kind of a fracture. But if the fracture have caused the skin to be pierced, there is a damage to the skin, and you can openly see the fracture from your naked eye, so it's an open kind of fracture. So now the fracture, the bones are in directly contact with the atmosphere, so it's an open fracture. In open fracture, it can be further classified into two, whether it is internally open or whether it is externally open. Internally open means the fracture have caused the skin to be pierced. So if imagine this is the whole bone, and if it breaks, so the internal force, the internal bones and the sharp edges of the bone is causing the skin to be pierced, and the force is from inside and it is going outside with the help of that. So when a fracture is happening, it is causing the skin to break from the inside. It will call as an internal open fracture. If it's an external. If some blow is hit from the outside, if some injury is caused from the outside and it has pierced the skin, it has made the wound open and the fracture open, it's a externally open fracture. Next classification is according to the complexity, if it's a simple or it is a complex. Earlier what happened, जब starting में ये terms आई थी तो simple और complex के लिए terms थोड़े से अलग थे. We don't have to study that, but just for your information, सिंपल फ्रैक्चर उसे कहा जाता था जिसमें ज्यादा क्या कहते हैं कि if it's a closed fracture, if it is not open, then it was called a simple fracture, कि एक नॉर्मल फ्रैक्चर हो गया है. और कॉम्प्लेक्स फ्रैक्चर उसे कहा जाता था जहां पे वो फ्रैक्चर ओपन है. सो नाउ द टर्म्स हैव बीन चेंज. अब अभी के लिए हमारे सिलेबस में और अभी नॉर्मल आउटसाइड हम जो यूज करते हैं, इट्स बेस्ड ऑन अ ट्रीटमेंट विच इज रिक्वायर्ड. So a simple fracture will require a normal simple treatment जहां पे फ्रैक्चर एक सिंपल तरीके का फ्रैक्चर है. It can be closed, it can be open. A complex fracture means it need there are more fragments to it, and remember, now more number of fragments, the more complex the fracture is. More blood loss, more critical the situation of a patient is, more complex the fracture is, more critical the fracture is, the more complex it is, and the more critical treatment will be required. So based on a treatment, we have classified them into the complexity, we have classified them into whether it is a simple, whether it is a complex. So if it is a simple to treat, it's a simple fracture. Any fracture which is simple, there is a simple hairline fracture, there is a simple traumatic fracture, there can be a simple stress fracture. So जब हम उनके पैटर्न के बारे में देखेंगे, we will know further about it. Complex fracture means कि वो फ्रैक्चर जो है वो बहुत ज्यादा कॉम्प्लेक्स, उसको ट्रीटमेंट के लिए बहुत ज्यादा कॉम्प्लेक्सिटी विल बी रिक्वायर्ड एंड इट्स अ कॉम्प्लेक्स. व्हाई द टर्म्स हैव बीन रिप्लेस्ड. अगर मान लो कि इफ इट इज अ सिंपल फ्रैक्चर, मान लो कि नॉर्मल ट्रांसवर्स फ्रैक्चर हुआ है, एंड इफ इट इज अ ओपन, we can easily restore it. But imagine if it is a kind of oblique fracture, a spiral fracture, but it is still closed fracture, वो open नहीं है, but it is will be more complex than the one I have mentioned previously. So if it is a transverse fracture but open, still it can be simple to treat. If it's a oblique fracture which has a piercing end on the both side of a bone, and it may damage the skin, damage the muscle, damage the internal any nerve, so it can get complex even though it is a close one. So based on the treatment required, based on the complexity, we can classify them into simple and complex. Moving forward, on the basis of quantum of force causing the fracture. सिंपल, अगर हाई फोर्स की वजह से फ्रैक्चर हो रहा है, सो इट्स हाई वेलोसिटी फ्रैक्चर. अगर किसी लो फोर्स की वजह से फ्रैक्चर हो रहा है, देन इट्स अ लो वेलोसिटी फ्रैक्चर. व्हाई डू वी नीड टू पुट दिस क्लासिफिकेशन? सो with the help of this classification, we can understand the impact on a bone which has been caused by the external force, or sometimes it can be an internal force from a muscles, or from any mainly from the muscle or ligament. So depending on that, we can classify them into high velocity or low velocity, and according to that we can understand whether how much severe the damage could be. So moving forward, according to the displacement. Now this is a very interesting part and often confuse student, whether your fracture is displaced or not. It's as simple as that. But if it can be undisplaced, so yeah, the fracture has been there. Let me demonstrate with a 2 pen. Imagine this is a whole bone. Okay, this is a whole bone. There is no break in it, and simple here there is a break. Okay, here fracture has been caused. So now the fracture is the both bones are in place. It hasn't displaced from its position, so it's an undisplaced fracture. Simple term. Your transverse fracture, as shown here, a transverse fracture, it can be a undisplaced like this. So both the fragments, the proximal and the distal one, they are in alignment. So it's easy to treat them, it's easy to realign them, and they haven't displaced from their position, so it's a bit easy. So they will come under the undisplaced fracture. Now, what are the displaced fractures? So both the line they are not in alignment. The distal segment have moved here or there or here or there according to the force. तो फोर्स कहीं से भी आया है, कैसा भी फोर्स लगा है, तो उसकी वजह से या मसल्स के पुल की वजह से जो डिस्टल सेगमेंट है इट हैज बीन शिफ्टेड एंटीरियर, पोस्टीरियर, मिडल और लेट, दैट वी डोंट नो, but it is not in align, so we will call it displaced fracture. Now displaced fracture, there are many things which we have to consider. It's a fracturing force, मतलब किस तरफ से फोर्स लग रहा है उस पे निर्भर करता है कि वो किस तरफ डिस्प्लेस होगा. मसल पुल, sometimes what happen, oblique fractures has happened, like for example, so there is an oblique fracture. Imagine an oblique fracture. Now this the proximal the distal segment, it has been pulled by muscle from this side. Okay, so they are pulling it from this side, so it will go from this side. If muscle pull from this side is more, the fragment will go on this side. Simple as that. And according to the gravity, sometimes what happened, the gravity also plays the role, and the distal segment which has been displaced, तो gravity की वजह से मदद से भी, क्या gravity की वजह से भी वो लेफ्ट राइट या कहीं और जगह पे डिस्प्लेस हो सकता है. फॉर एग्जांपल, if you have if a person has sustained an injury over a road traffic accident, so आपने उनको एम्बुलेंस में डाला, but the limb was hanging, there was no place, no stabilization was given, so that may get displaced posteriorly. So according to that, it has been classified as undisplaced or displaced. Now यहाँ पे confusion start होता है कई बार in a naming of a fracture. कई बार जो displaced fracture होते हैं उनके नामकरण में थोड़ी सी confusion हो जाती है. तो सिंपल एक चीज याद रखनी है कि हमारा जो proximal segment है, it has been placed with the skeleton system, तो वो अपनी जगह पे ठीक है. टूट के तो नीचे वाला जा रहा है ना, तो वो किस तरफ गया, the displacement will be named according to the distal segment in relation to the proximal segment. So allow me to demonstrate. If this is a distal segment, this is a proximal segment, and this bone has been fractured. Okay, now as you can see, consider this is anterior, my side is posterior, this is medial, and this side is lateral, this is medial. So now this fragment has been gone this side, so it's a medial displacement. It has gone this side, it's a lateral displacement. Okay, if it has gone anterior side, it's an anterior displacement. If it has gone posterior, it's a posterior displacement. As simple as that. Okay, so we will name the displacement according to the distal segment's position in relation to the proximal segment. Distal segment किस तरफ है, आगे है तो anterior, पीछे posterior. अगर middle side पे है तो medial, and lateral side पे तो lateral. Simple. Now moving forward, we can classify the fracture according to the patterns they have. So what pattern do the fracture will having? So first we will see about the transverse fracture. What do you mean by transverse fracture? Imagine this is a bone. I'm demonstrating in a long bone so you can understanding nicely. If the fracture has happened like this is the break in a continuity. So if a fracture is like this, it's a transverse fracture. Simple. Now what do you mean by oblique fracture? So for oblique, if it is crossed like this, not straight, this is the break in the continuity, and it's a kind of cross way, so it's a oblique fracture. Oblique. What do you mean by spiral fracture? Now spiral fracture, it can be of three-dimensional like this. So spiral fracture, it will happen when there is a twisting force, some kind of rotation is added to the force. So when this kind of force is applied to the distal segment while the proximal segment, the upper bone, is stable, so with the help of that, what happened, it's a kind of a spiral shape fracture will happen. It's a very complex to treat, and it required more stabilization compared to the transverse and oblique. Okay. I forgot to mention the transverse fracture occur due to any trauma, direct blow, and the oblique fracture, it can occur if the bending force is applied, if the force is at an angle, and mostly there is a bending involved, so it will cause. And spiral fracture occurs because of the twisting force applied on a bone. Moving forward, what is comminuted fracture? Now, comminuted fracture means, just a second, let me take a duster. Yeah, here. So, what do we mean by comminuted fracture? Comminuted fracture means there are more than two fragments are there. So here there is a break. Here there is a break. One bone is in this fragment, one bone is this. मतलब चूरा होने लगा है थोड़ा सा. So there are more than two fragments, there are more than two. So now we have four bones. It's a comminuted fracture. It can be happen due to any compressive force, any high velocity force. It can cause multiple fragments, and as I have told earlier, जितने ज़्यादा fragments उतना complexity ज़्यादा. That's a comminuted fracture, जहाँ पे number of fragments ज़्यादा होते हैं, and it's a this. वो क्या कहते हैं कि टुकड़े वहां बीच में रह जाते हैं, उन्हें इकट्ठा करना, उनको वापस रिमॉडलिंग करना थोड़ा सा मुश्किल हो जाता है. देन सेगमेंटल फ्रैक्चर. नाउ व्हेन अ फ्रैक्चर इज एट मोर देन वन साइड, तो यहां पे भी एक फ्रैक्चर हो गया है, यहां पे भी एक फ्रैक्चर हो गया है. दिस इज segmental fracture. There are multiple segments which are involved in a bone जहां पे fracture है. Then avulsion fracture. Now what is avulsion fracture? If there is a more muscle force is applied, if the ligament force is more, if the tendon have applied more force, और वो वहां से अपनी जगह से उठ जाता है, वहां पे अपनी जगह से उखड़ जाता है, and they pull some bone chip with them, they pull some fragments of bone along with them, तो उसे हम avulsion fracture कहेंगे. So imagine if these are some bony fragments and the muscle is been pulled. So as I have seen, I have taken some fragments of bone with me, some particles, some chip of a bone with me, so it will call as a avulsion fracture. My duster is okay. So moving forward, what is green stick fracture? Green stick fracture commonly seen in small children, जहां पे उनके the bones are still in a developing stage. The bone has not gained that hard structure, that complete strong structure. The bone is still as a green bark of a green stem of a tree. So वहां पे क्या होगा? It will not break the bone completely, but it will bend the bone. It will twist the bone. So ग्रीन स्टिक फ्रैक्चर, वहां पे जो बेंडिंग फोर्स होगा, जो भी फोर्स की वजह से फ्रैक्चर हो रहा है, तो इट विल बी इन द बोन विल बेंड. It won't break completely, but bone will bend, and as the bone is in a growing stage, it has a good chance of recovery. So ऑर्थोपेडिक्स भी क्या करते हैं, उसे बस स्टेबलाइज कर देते हैं, अलग अलाइनमेंट से ठीक नहीं है तो, और प्लास्टर से वो फिर कुछ हफ्ते में ठीक हो जाता है. आई रिमेम्बर वन ऑफ माई फ्रेंड दर्शन, तो स्कूल में उसे वो गिर गया था, हाथ में चोट लगी थी और हाथ पूरा बेंड हो गया था, एंड वी वेर हॉरिफाइड बाय सीइंग दैट थिंग ऑन अ वेरी अर्ली एज. तो पूरा हाथ मतलब ऐसे यहां से वैसे उनकी खून होती है ना, वैसे पूरा हाथ हो गया था. सो या, ही इज अ वंडरफुल डीजे राइट नाउ. आई डोंट नो वेदर ही विल सी दिस वीडियो और नॉट, बट या, आई रिमेम्बर हिज केस. तो वहां पे ग्रीन स्ट्रिक फ्रैक्चर हुआ था उसे, एंड इट्स कंप्लीटली हील्ड, and wherever you are, best of luck. So that's a green stick fracture. Then it's a hairline fracture. As the name suggests, hairline, बालों की जितना बारीक ये फ्रैक्चर होता है. It can be because of any reason, trauma or anything. Now one of the most interesting thing about hairline fracture, कि अगर मान लो कि आपको आज चोट लगी है और आप एक्सरे करवाने जाते हो, देयर इज अ कॉमन डायग्नोस्टिक टेस्ट वी सी चेक फॉर द फ्रैक्चर। तो अगर आपको आज चोट लगी है और आप आज एक्सरे करवाने गए, एक्सरे में कुछ नहीं है, नाउ यू आर टेकिंग दैट रिपोर्ट टू ईच एंड एवरी डॉक्टर, और ये बहुत कॉमन हमारे पास पेशेंट ऐसे आते हैं। So what will happen? You'll come to us after 1 week or 2 week, and you'll say कि you had a history of a fall a few weeks back. This is an X-ray. X-ray is totally normal, but still you are having a pain. I generally ask them 2 or 3 questions, mainly to rule out whether it's a hairline fracture or not. The first question is whether the pain has been worsened over the period of time. So if it's a hairline fracture, तो hairline fracture में क्या होगा कि the bone will look completely all right in the first X-ray on a day of trauma or the next day of trauma, बहुत ही परफेक्ट दिखेगा। एक्सरे में बिल्कुल भी पता नहीं चलेगा कि वहां पे कोई फ्रैक्चर है। So my first question is whether it is get worsen over the period of time. मानो एकदम बारीक फ्रैक्चर हो गया है, दिख भी नहीं रहा है एक्सरे में। So होता क्या है कि as the patient is not taking any rest, the patient is not taking any precautions, तो over the period of क्या होता है, वो उन हाथों को यूज करता है या पैर को यूज करता है, तो वहां पे फ्रैक्चर धीरे धीरे बढ़ता जाता है। वो बढ़ता है, इसकी वजह से पेन भी धीरे धीरे बढ़ रहा है। सो इट्स अ फर्स्ट क्लासिकल साइन ऑफ अ हेयरलाइन फ्रैक्चर। ओके, कि एक तो ये है कि भाई वो पेन बढ़ रहा है। सेकेंड, व्हाट आई आस्क देम इज कि टू हैव अ recent x-ray, even they have taken x-ray over 2 week back, तो अगर पेन बढ़ रहा है तो दूसरा एक्सरे लेना है, वापस वापस एक्सरे लेने के लिए नहीं भेजना, नहीं तो फिर आपके पास दूसरी बार नहीं आएंगे, बोलेंगे भाई डॉक्टर तो झोला छाप है। तो अगर पेन बढ़ रहा है then you can take a second x-ray or 2 week later, you might see, it's not completely guaranteed, if it is big wide enough you will be able to see, but you might see the hairline crack on a second x-ray after 2 weeks. So it's an early indication to have the hairline fracture, to diagnose the hairline fracture. Third thing I ask them, when you apply ice, if it is paining, when you apply ice, the pain will get worsen if it is a fracture, if it's a hairline fracture. So most of the cases they happen to experience this, that after applying the ice, the pain get worsen, and it get worsened during the night period also, whether they are applying any force to it. So these are the basic technique which you can use to rule out the hairline fracture. Okay, so and over the period of time the hairline fracture will grow, it will get bigger and bigger if no treatment has been provided over that part. So hairline fractures को detect करने के ये 2-3 questions है which you should ask your patient next time they visit, and it can also help you to rule out the possibilities of any hairline fracture. Okay, moving forward, burst fracture. Now burst fracture occurs most probably in the vertebral bodies, your vertebral spine. Burst fracture क्या होता है कि the vertebral bodies it will shatter, उसके ऊपर they will shatter into all the direction due to any pressure or due to any pathology. They will just shatter, they will just burst out. It's known as a burst fracture. Then crushed fracture or compression fracture. So जैसा कि it's a kind of burst fracture only, but more severe than burst fracture. So as the name suggests, crushed fracture, अगर मान लो कि ऊपर की तरफ से कोई compression आ रहा है spine पे या उस रीजन की वजह से वो फ्रैक्चर हो रहा है, तो it will also happen into the spine. तो वहां पे compression की वजह से, क्रश होने की वजह से फ्रैक्चर हुआ है, सो उसके बहुत सारे फ्रैगमेंट्स होंगे, वो आसपास बिखर जाएंगे। Then fracture with dislocation and subluxation. So now if there's a fracture और उसके साथ जॉइंट का डिसलोकेशन हो गया है या सबलक्सेशन हो गया है, that will come into this category. So it will follow this pattern. So right now we have talked about all the patterns, all the classification of a fracture. One more thing, जो dislocation subluxation है, इसमें often confusion होता है. So if this is a convex surface of a joint and if this is a concave surface of a joint, this is a convex surface, क्या होता है कि अगर मान लो फ्रैक्चर हो गया फोर्स की वजह से और जो आर्टिकुलेशन है वो कंप्लीट बाहर हो गया, then it is a dislocation. अगर वो partially अपनी जगह से हटा है, there are some still articulation, some part of articulation is still intact, then it's a subluxation. If it is completely out, it's a dislocation. Fracture force can affect the joint capsule, as we have just learned about the subluxation and dislocation. It can also affect the ligament also. So ligament में भी injury हो सकती है. The injury can be classified into 3: first degree, second degree and third degree into the ligament, जिसे हम sprain कहते हैं. So what happened in the first degree of a ligament injury, of first degree of sprain? Kuch fibers, some fibers of a ligament, they get affected. Imagine this is a ligament. So if this one fiber is has been torn out, if the one fiber has been broken out, still it has 3 fibers intact. So it will be seen as a local tenderness, limited swelling, but the function is somewhere intact. So with the help of some days rest, some ice price protocol, and the patient can get back to normal life. What is grade 2 degree of sprain? What happened in that? The 1/3 or more than 1/3 to up to 2/3 of ligament have been torn away. Some partial, एक या दो बाकी है, बाकी के ये सारे टूट चुके हैं. Some part is intact, some fibers are still intact. Obviously swelling ज्यादा होगी, disability ज्यादा आ जाएगी और ज्यादा टाइम लगेगा, कुछ हफ्ते लगेंगे इसमें रिकवर होने के लिए. And orthopedic brace, rest should be given to the patient, and it take a bit more time. And up to this phase, the conservative treatment will help to get back the patient to the normal ADL activities. The third degree of a sprain, जहाँ पे जो सारा लिगामेंट है सारा का सारा टूट चुका है, सारे फाइबर टूट चुके हैं, and यहाँ पे surgery is must. So according to this, you can classify the ligament injury grade 1, grade 2 and grade 3. So that's all for today. If you have any doubt, if you have any topic in your mind, just drop that topic in the comment box and let me know, and we'll try to make a video on it. So thank you so much. Thank you so much for watching. Do let me know in a comment box how you feel. If you need any feedback to give me, it's most welcome. And we will continue. I'll put some other videos on other topics also, but I'll try to continue this fracture topic further by upcoming topic like healing of a fracture and some more topics from ortho or surgery. So yeah, definitely I'll keep keep posting on a regular intervals. I'll keep doing that. So thank you so much. Have a nice day.